Hey guys, so in this video we're going to go through a PA mobilisation of the thoracic spine. Previous video we just did a second ago, or in the assessment section, we went through how you differentiate between the spine and the rib, and also just how you'd feel for restrictions and feel through that thoracic spine as a general scanning assessment. So once you've got an area that you want to work on, there's plenty of different treatment options that you can use for the thoracic spine, and on the website there's going to be those. There's also going to be videos on how you pick and how you sort of clinically reason through what you're going to use. But one of the things that you could potentially use would be mobilisations of the spine. So again, what you do is you come onto that area that you found. You would then literally just apply some pressure using your hand or using the thumb, depending on where you feel is easiest. Everyone's slightly different, and that's fine as long as you know where you are. And then you literally just apply a downward pressure. If you've been taught Maitland mobs, so you can go through your grading if you want to. I don't know how Glenn feels about this, but I personally just go to where I feel it's restricted, and then I just literally work through that area, and I do it until it feels like it's loosening to me, and then I'll always do some sort of retest before and afterwards. So if they're stiff in their thoracic, you're going to expect probably that some form of rotation in your assessment is going to be limited or restricted, whether that be to the left or to the right, and then you would then retest, do your mobs until you feel that they've loosened in that area or got more movement under your hand. And then you go back and retest that movement you've just been doing. The other thing we're going to go through in future videos is mobilisations with movement, which I think are really nice, and I use those quite a lot as well. So yeah, it's simply going onto that transverse process and then literally doing a downward PA pressure. Do you angle this when you do this at all, in terms of?
Yeah, depending on where you are in the spine, the alignment of the facet joints will influence the line of push.
Yeah, cervical is going to be more at a 45
degree angle up towards the eye is a good way to orientate that.
Exactly.
And then when you're in thoracic, you still have that slight angle at the top, and it starts to become less steep as you go to lower thoracic spine.
And then lumbar's just straight through, isn't it?
Lumbar's pretty much a straight PA, yeah.
And again, I think that a lot of the evidence kind of will poo-poo a little bit whether you can be exact, but I think we've talked about this before. I tend to feel like that's what I'm doing, in terms of that's what my aim is. If you're not getting it perfectly right, and if then fine, but that's the kind of aim that you're going for, because it makes more biological sense, basically. I
think it improves your handling and your confidence in the technique that you're doing. The more recent evidence is that you're really pretty much just stimulating various mechanoreceptors and getting an inhibition of pain that way. Yeah. But still, I think we need to concentrate on our handling, and the more specific we are to the area of their pain, the greater the effect I think we're going to have on whatever the mechanism.
Yeah, exactly. Because if you're being specific to that area, that particular joint, those mechanoreceptors are going to be more specific to that joint.
Exactly.
Whether that's whether you're getting movement, whether it's in terms of the actual effect, we know that there's from being in clinic, that when you work manually with people, they do improve in terms of their movement. Then you get them moving. Exactly the mechanism of that are unsure, but we know that it helps. So that is how you would do a PA mobilisation of the thoracic spine.